Hello, everyone. You're welcome to ETV Ghana's African Women's Voices Show. My name is Eunice Tony, and I'm so happy to be watching and also having to talk to you this evening. Those of us who are yet to log on to Facebook Live, please do so. Or if you're standing by someone who is yet to log on, please help me get the person to log on to Facebook Live, because we need everyone to really pay great attention to today's topic. We're going to be talking about something that there's awareness around, but somehow we just tend to forget. So today we want to remind us all about this particular thing we're going to be talking about. If you've been following us on social media, I'm sure you have an idea of the topic, but if you're not, I'm going to keep you in suspense, okay? I hope you had a splendid Monday. And today being Tuesday, is still the beginning of the week. I want to say have a great week. And I'm so happy you've tuned in to ETV Ghana, where we always give you the best when it comes to entertainment and information and education. So we've got some messages here from our sponsors. And if you are just joining us for the first time, Voltic is one of our sponsors. And just recently, in fact, on Saturday precisely, the Ghana Beverage Awards was organized, and Voltic, our sponsor, was awarded Voltic Water of the Year. So I want to say a big congratulations to Voltic for winning the award as Water of the Year. And we want to say thank you for Voltic, having hydrated us through these COVID times, and will also continue to hydrate us even after COVID leaves us, because we all believe COVID is going to leave one day. Say amen. Amen. Okay, so we have another message here from GMA, the group. It's actually our financial month, and we are talking about everything financial literacy. If you remember, last week we talked about how to manage your finances. But today we're not going to be doing finances, because there's something really important coming our way across the world. That's why we are going to veer off finances. But the information still stands. It says that you should tune in to all our shows to learn more about budgeting, saving, financial inclusion, and how to invest your hard-earned money. Be more informed how e-money can help you make payments, and how it can make it easy for you to make payments. So when you go through our platforms on YFM, Happy FM, or ETV, you get much more information around it. It is the Financial Literacy Month on ETV Ghana this June. So for sponsorship, we are asking you to kindly WhatsApp 02022222059 or 02022222095 or 024-288-4571. And our sponsors are the Consolidated Bank of Ghana, popularly known as CBG. So we're going to be taking a short break, but within this break, we're going to be going over to the 60 seconds update segment. And we've got some information for you that you really need to know about. When we return, I'm going to be introducing our guest to you. Do stay tuned.
University of Ghana appeals to students to keep visitors out. Professor Nanaba Apia Amfo, Pro Vice Chancellor, Academic and Student Affairs, University of Ghana, has appealed to students of the institute to keep visitors out of campus as part of measures to contain the spread of COVID-19 pandemic. Professor Amfo made the appeal on Monday when she toured the university as part of activities marking the reopening of the institutions for final year students. She said, "They are here for a short while to complete their exams, and so they should comply with the directives. Keep the visitors out so that they all are safe." She also said once the university took delivery of personal protective equipment, PPE, promised by the government, they would be distributed to the students. 20 years of dedication and service. Pearl Amako's rise through the ranks of U.S. Chief Warrant Officer 2, CWO2. Pearl Amako is not just any ordinary officer of the U.S. Navy. Her story of rise within the service has been one of determination and self-sacrifice. She is currently the Food Service Officer at the U.S. Naval Base in Cuba. Amwako was born in Accra, Ghana, but later migrated to the United States, where she graduated her high school and enlisted in the United States Navy and reported to Recruit Training Command, Great Lakes, Illinois on August 4th, 1999. She has been awarded the Joint Commendation Medal, 7 awards from the Marine Corps Achievement Medal, Good Conduct, and many more. In an interview, she said her next goal is to rank up to CWO3, CWO4, and CWO5 before she retires. I took my manager to a prayer camp to manage me, Selina Boateng. Gospel musician Selina Boateng has revealed that she took her former manager into prayers before she was called to Accra to start her music career. Selina narrated the struggle she went through to get a manager who promised to manage her, but later disappointed her. However, she felt so bad and went to a prayer camp to pray over the man who later called her to come to Accra to begin her career. According to her, she was more of a backing vocalist to most gospel artists by then. So what she didn't understand was why she had to face hard times before getting a manager.
And you are welcome back. I hope you noted that health tip. Very important. I would also like to remind you that coronavirus is real and it's around. So we need to all take the safety precautions that are needed and are being prescribed on TV, on radio, online. Everywhere there's a lot of education going around about coronavirus. And we want to say, please take good care of yourself. So now let's get to the main issue of the day. We're going to be celebrating World Sickle Cell Day on the 19th. But ahead of that, we have brought in an expert who is going to talk to us about what sickle cell actually is and things to expect if we somehow get in contact with somebody who's got sickle cell, how you even get it. And we also have somebody here who has a child who is sickle celled as well. So we're going to be getting a lot of information on ground today from a doctor's perspective and also from a parent who is taking care of somebody who has got sickle cell. So whatever it is that you're doing, just grab your Voltic, sit down and just listen to us as I welcome our Dr. Yvonne Nanama Brew. How are you?
I'm fine.
You're very much welcome. She's a pediatrician at the Ridge Hospital and has got a vast experience around sickle cell. So on my immediate right, we have a parent who has a daughter who is also suffering from the sickle cell disease. She's going to be talking to us about her experiences around it and probably give us some tips as to how she's been able to manage the situation so far. Because for her to be 13 years, she must be doing something really wonderful, and we all want to appreciate her. She is no other person than Awo Victoria Chumesi. Please, you're welcome.
Thank you.
All right. So let's delve in. Doctor, please, when they say that someone has got sickle cell, what does it actually mean?
Okay, so when we say someone has sickle cell, we'll need to differentiate two things. Does the person have sickle cell trait or sickle cell disease?
Okay.
Good. Now, the trait means that you have one of the genes that can give birth to sickle cell disease. So we have a lot of people in Ghana, 25% actually of babies born in Ghana will have the AS or AC. So they'll have a trait. So they are absolutely well, but they have the trait. Then we have the sickle cell disease. So these are people who have inherited two genes, one from the mother, one from the father, and both are abnormal genes. And the abnormal genes are either an S or a C. So they have an S with either another S or an S with a C or an S with something else, which is not an A. Then we will say that person has a sickle cell disease. So those with the sickle cell trait, as in those who have AS, are not sickle cell disease, and they do not fall ill.
Okay, I was going to ask you that.
So we
did
need
they
to
experience
differentiate.
anything?
No, they are well, absolutely well, and may not even know they have the trait. until perhaps they get tested, or they get a child who has the disease, and then they go get tested and find out that, oh, I had the trait. So they're absolutely well, but then they can give birth to a child who has the sickle cell disease.
Okay, so if I understand you very well,
Yes.
if you are AS, you have a trait.
Very
If
good.
you are AC, you have a trait.
Very good.
But if you are SC, what would you call that?
You
a
have
trait?
sickle cell disease.
You've got sickle cell
Yes,
disease.
because both genes are not normal genes. The normal gene is AA. So if you have A from your mother, A from your father, you have both normal genes. But if you have an A from your mother and either an S or a C from your father, then you have a trait, sickle cell trait, and you're absolutely fine. But then if you meet someone else who is similar to you and also has an A with an S or a C, then it's likely your child may choose to pick the S from you or the C from your other, and the two together will give you one of the sickle cell diseases.
Okay, so what would we say is the difference between an SC and an SS?
Good. That's a very good question. So the SS means the person took an S from the mother and an S from the father. So the two together is SS.
Okay.
The SC means the person took an S from the one parent and a C from the other parent. So they are both sickle cell disease. However, those with SS usually tend to be more sicker than those with the SC. So we tend to know those who are SS because when you see them, you can actually see, oh, this person is not feeling too good. But the SC may be normal because the C gene is not usually a very severe, does not give severe disease. Okay. So they may have issues, but not as much as those with the SS.
Okay, so they may have issues because maybe the S is in this with the C.
Very good.
Unlike the person who's got double S.
Double S, very good.
Oh, okay, interesting.
Yes.
So, just before I come to you, I need to find out something more from the doctor. So, from what you're saying, it means that since this is a show that tackles issues around women, and women are the ones who actually give birth to these babies, what precautionary measure should we take before we get to meet our partners?
This is an excellent question. We can't say don't fall in love. Yes, and we can't say don't marry someone. But it is just right for you to know what you are going into. Okay. So you need you need yourself to get the HB electrophoresis test. Please don't do a sickling test, because the sickling test will only say you don't have an S. It does not tell you don't have a C, or you don't have the other. There are other ones as well, actually, but they are not so common. So we don't usually talk about them, but there are so many others. There's thalassemia, there's D, and there are other genes.
Wow.
But the commonest ones in Ghana is the S and C. So that we don't confuse people, I just want to concentrate a lot on the S and the C. So just test yourself first with an HB electrophoresis so that you know that you are an A with an S. And then you can then make a decision. If I'm married or I have a child with anyone, and you can choose to have a child with any one of your choice, but just know what you are going into. So that if you are AS and you choose to go with somebody who is also AS, you get information and be exactly prepared to take care of the child that may come out of it. It doesn't necessarily mean all your children will have sickle cell or none of them. You can't say. But it's possible that you can have a child with sickle cell disease. So just take that precaution of testing yourself, testing the partner you want to have a child with, and be certain we are AA and AA, and we want to marry. We are AS and AS, and we want to marry. No one can stop you. But then you should be fully aware of what you are going into so that you do not blame the child for your own poor decision-making prior to having the child. Okay. If you knew you were going to have a child with SS, that there was a risk, and you took that risk, when that child comes, then there'll be a lot of joy in spite of the child's diagnosis. I think the worst things we see as doctors is a parent blaming the child. Now, hamisa, now, you're free. No, the child did not beg you. You see, so take your time, make the decision yourself, and decide this is what I'm going to do. And then you can go ahead.
All right. Thank you very much, doctor. So that moves me to Victoria. Victoria, I just asked her the precautionary measures a woman should actually take before getting to meet a partner she wants to have a child with. Did you know about this precautionary measure?
Yes, in fact, I was very much aware of it.
Okay.
And for me, because I have another child who is not sickle cell, it was just, well, you never know what could happen. So you have a child and, they get tested and, that's the diagnosis. And so, what more can you do but to learn about it and know how to manage and care for your child? And that's exactly what we did.
Okay, all right. So did you have this child with the same partner and that one is not
Yes.
sickle celled?
Yes.
Okay, all right. So did both of you have a test before you got married, before you started having the children?
It was right around the time that we decided to have kids that we had our test. So we were aware that
There's a chance?
Yes, there's a chance. However, for me, because we were living in the U.S. at the time, it's not as big. It's not mandatory. It's not talked about as much as it is here in Ghana.
Africa.
So, it was one of those things where, you could either, it was optional. You could either test for it or not. And we decided to test for it. And we both, were in good standing. It could be, there's a chance it could be and there's a chance it could not be. So after having the first child, you want to have a second child. You just hope that everything comes out the way it needs to. And if it doesn't, God has given you the child. So you find how best to care for the child, love the child, and then, see what happens. And it's been a blessing since then.
Wow, I really like the enthusiasm and the joy with which you talk about this baby of yours who is now 13 years old. Could you take us through exactly what it is you started experiencing from birth? Did you have a difficult pregnancy? Was it normal? Especially because you've had a first child and everything was fine. So how was pregnancy, carrying this particular one?
Pregnancy was fine. It was perfect. It was the same as the previous child I had had, and the baby came. They were fine. It was maybe a month or two after the baby came that the testing was actually done for us, and that was when we got to know. And so from there, we had a very great doctor at the time, and quite frankly, we've had great doctors over the years. And they basically gave us as much information as we needed, and also gave us tools and resources to use to learn about it, educate ourselves, and also a support system. We used to have a support system that worked really well, so we could ask questions. All that I would have 10,000 questions.
I would like to hear about those
so,
questions right after this commercial break. We'll be right back. And you are welcome back. Just before we went on the commercial break, we were talking about how pregnancy was for Victoria when she was carrying her 13-year-old, who is her baby, who is now 13 years old. She also talked about the fact that they knew about the situation they were going to get in, and they hoped that things would just, get better. And when they received their baby and it happened the way it was, they still received their baby with joy and have been with her all this while. And I would like to continue with the conversation from where we stopped. So you mentioned, that you received the baby with joy, and the
Absolutely.
doctors even were giving you some tools that you could use to take care of the baby.
Absolutely.
All right.
So I think well, over in the U.S., I think they have the measures they have there are slightly different from what people are used to in Ghana, but it's almost about the same. You just need to also do your own research. In addition to that, one of the things they educated us on was the likelihood that there will be some crisis, which is mostly pain crisis. the fact that, you know, a common infection of any sort could be exacerbated because of the child's condition. And also, you know, some sort of day-to-day precautions that we needed to take and just make it a part of our lifestyle to ensure that, you know, our child had a meaningful life. So with all of those, we adopted them. And one of the most common one we do is, you know, keeping the child hydrated. So they have to be well hydrated throughout the day. It's very important for any child to be well hydrated throughout the day. So that's one thing that we started very, very early on with the child. The other thing too that, you know, you as a parent need to almost take charge of is, you know, monitoring, you know, any kind of changes with your child. So if your child has a fever, you need to know the threshold, the fever threshold where you actually need to go into the hospital and get treatment. So we had a standard protocol. If the child has a fever above a certain you know, degree, so we would have to go into the hospital and then get sort of, you know, pre-established treatment protocol. And with that, you know, the hospitals knew about it. So when we get there and we say, oh, the child has, you know, a fever of this high, and you know, this is her diagnosis, you knew exactly what to do.
Okay.
So with that, you have to take charge of it. You have to make sure that you follow through on those things to ensure that, you know, your child isn't having frequent hospitalizations, but also crises as a result of that. So the better you care for it, the much easier it becomes to live with it, and you know, you have a very meaningful quality of life.
Beautiful. So now that we know from the parents that infection is something they really have to avoid, and keeping the child hydrated is something they really have to keep upping their game on all the time, I'll be coming to you, doctor. What I want to ask is, she mentioned that when they come to the hospital, they receive them, and everybody, those who actually know their history, know what to do, even though she still has to follow through. I just wanted to ask, do they have to go to the normal clinic, or is there a particular kind of clinic for them?
Yes, I think that one of the first things that we want every child with sickle cell to do is to be enrolled in a sickle cell clinic.
Okay.
Fortunately, we have enough, or we have quite a number all over the country. In Accra, there are so many of them that parents can take their kids to join.
Please, if you can help us to say, because maybe some of us may not know,
okay,
you know, some of the clinics.
The first thing is all the big, very big hospitals like Kolebu, Konfanochi, Tamale Teaching Hospital, will all have
the sickle cell
a
clinic.
Sickle cell clinic, yes. And then the tertiary hospitals, 37, Ridge, and then all the regional hospitals, wherever you are, Wa, Bogatangat, Sunyane, mention it, even Tema General, every big hospital where there's a pediatrician and or there are enough doctors will definitely have a sickle cell clinic. So we encourage every parent to ask the doctor at the clinic where you've been to refer you to a sickle cell clinic, so that you are registered there. You get to know the doctors there, they get to know you too, and then you sort of build a relationship. Then you get to meet other parents as well, and that is where you can then, for instance, join the association.
Okay,
and
there's an association.
Yes, she's a vice president of the Ridge Association.
Wow.
Yes, so the association executives and members also go around to interact with the members, and to sort of help them sort out some of these issues and all. So the first thing is your child must be registered in a clinic.
A sickle cell clinic.
Yes, in a sickle cell clinic.
Okay.
And yes.
In other words, what you're advising is that most of us as mothers have to try and go through, you know, antenatal. Because if you go through antenatal, there's a chance that you're going to be told that you are likely to have a child like this? Or is it that maybe after the baby is born, then they get to let you know that there's a situation? Or do you need to ask for the test first? Is there a way you can even tell before the baby is born that this is the situation?
Okay, so for those who get tested before they get pregnant and know their status, they, right during pregnancy, can get a test done to see if the child has sickle cell disease.
Okay.
Yes, that is those who know before they get pregnant. Now, we have those who know maybe during pregnancy, because every woman is tested during pregnancy. So such people are told that it's possible your child may have sickle cell disease. At birth, every child with sickle cell disease, every child in Ghana, not only those with sickle cell disease, should be tested for sickle cell disease right at birth as
Okay.
part of our public health programs. At the moment, the only place that is taking place at is Kumasi.
Okay.
Any baby born in Kumasi over the last almost 20 years get tested free of charge for sickle cell disease. And that is what should be every part
Adopted across the entire
across
country.
board. You don't pay for it. As soon as your baby is born, the nurse takes a sample. The sample is sent to Noguchi. A result comes and tells you, okay, your child has sickle cell disease. And because of that, this is your doctor. And you are given a doctor who follows up your child. At the moment in Accra, it isn't done. And so what happens is the parent, when she attends the weighing, the weighing nurses at 6 months of age will request that every baby get tested for sickle cell disease.
Okay.
So when they find a child who has sickle cell disease, they will refer that child to the clinic, and then we'll continue from there. So, but there are so many missed opportunities because by 6 months, the child is still looking very fine. So many parents don't see the need to get tested. So then maybe the child falls sick and comes to the emergency room. And for us pediatricians, routinely, any child below the age of 5 who comes to the emergency room gets tested for sickle cell disease. That is actually too late because by then some of them would have died already. Yes.
Okay. All right. So I think it's best for me to ask the mother here. At what point in your baby girl's life did she start experiencing the crisis?
It's, it usually starts after between 6 months and 1 year is when you begin to see, some manifestations of it. Sometimes it's pain crisis, so she might cry on end, and you would have tried everything and not know what it is, and then eventually, you call the doctor, you go through the list of symptoms, and then they say, oh, a ringer, and it could be a crisis, and then they manage that crisis. So, from 0 to 6 months, they're usually fair off and okay. And then from 6 months is when you actually start, at least for me, that was when we started seeing manifestations of, crisis, minor crisis. And then, with time, you start seeing, different manifestations of it. And then you just learn and adjust as you go along.
Okay, so are you okay to let us know exactly what it is? Okay, maybe when the baby was a baby, she couldn't really say, I'm feeling, headache, or I'm feeling pains in my leg. As the child started growing, what are, the particular things that she would say she's actually feeling? What happens? They have a cold or they have a headache? What's the symptom like?
The crisis is called dactylitis, and that's basically wherever there's, the way it was explained to me was that wherever there's any bone in the body, there could be a crisis there. So wherever, if you think about the body, the human body, everywhere, there's bone. So wherever there is bone, any kind of bone in the body, any of that place could have a pain crisis. And with the pain crisis, it's, they feel, it just is excruciating pain. And I remember in one of the early support sessions, we were asking one of the older kids to explain to us what that pain feels like so that we can understand, so that when the younger child is saying, I'm in pain, we know exactly what that feels like. And basically the older kid explained to it as it feels like they're running a car tire over you. So when you think about that level of pain for a child to go through, and then maybe you take that child to the hospital and you don't get a very nice nurse.
Yes.
Then you get very upset.
Yes, I was going to say, so if this child is in this kind of pain, and you bring the child to the hospital and they are delaying.
Yes, so sometimes, and I think for me as a parent, that's when you take the opportunity to also educate the people that attend to your child so that they can know and understand, what the child is actually going through, how difficult it is for the child to manage what you're managing. The bravery alone for that child to have to deal with that and be okay, because some adults would not be able to manage that pain. And then with that, you just become a stronger advocate. So not to allow certain things, and to sometimes challenge certain things. For me, one of the things I had to challenge early on was, in giving the child maybe certain medications via, IV, intravenously. Sometimes the medication is painful when it's going into the body, and sometimes they are quick to administer the medication, whereas they can take their time and to diminish that pain that the child is feeling from taking the medication and also dealing with the crisis on top of it.
Yes.
So then you need to you learn to to advocate better for your child and make sure that the people that are caring for and attending to her can, empathize with what that child is going through
True.
and can help make it better. Because, while the child is going through that, causing, exerting more stress on the child can also lead to, even more crisis as well. So you want to make sure that you manage that too as well.
Okay, so children like this, are they averse to certain foods, or they are just normal when it comes to allergies and food? They can't take anything?
Pretty much. Pretty
Yes.
much, yeah, pretty much.
Okay.
It's, the way I think I've come to a point where usually when people ask me about this, I just tell them that, think about it as, somebody has diabetes from birth.
Okay.
How will they manage that? They live with it, they manage it. They just they know to avoid certain things. They need to get their blood sugar tested. They need to take certain medications. If they have a crisis, they know they have to go into the hospital, get attended to, and then go on and live their life. So it's just the same thing. I just say it's just like, any other health condition. You just need to manage it and then, see, and then know what to avoid. And you will have a very meaningful life.
Okay, awesome. So, doctor, we are in a time where a virus is actually after a lot of us now, and the theme actually is talking about how we are going to be dealing with sickle cell even in the midst of this pandemic. Does the virus actually, or would I say, does the situation or being someone who is suffering from sickle cell, does it make you much more susceptible to the virus? Just like they say for people who have underlying sicknesses, is sickle cell part of the underlying situations here?
Yes, at the moment we take sickle cell as a serious underlying condition.
Okay.
And so we take all the precautions for our patients. Data worldwide is still gathering. In Ghana, I think just a couple of sickle cell patients have had the COVID because right at the beginning of the pandemic, there were certain precautions that we told parents about. The first is that our children stay at home.
Yeah.
They don't go anywhere. They don't visit friends, and the friends of parents and other friends cannot visit for any reason. The child must be at home. Yes.
So that's fine. That's what we can say about the situation now.
Okay.
We know that, there's a chance, it's part of the underlying sickness. We've heard about diabetes and hypertension and asthma. So we should also consider sickle cell as one of the underlying.
Now, the reason we are very concerned about sickle cell is children with sickle cell can get chest issues.
Okay.
They can get the crisis in the chest. And the chest crisis can be very severe, and they need oxygen, and they have to go to ICU and things like that. So we assume that COVID, being a virus that causes chest infections, can worsen in sickle cell disease. And that's why we are extra cautious for our children.
Okay.
One thing we do, for instance, is we do not allow parents to come with them to clinic anymore.
Okay.
So now we have only parents coming to clinic.
Okay.
The kids stay at home, and we do phone and video consultations for the routine clinics. We only encourage them to come in when they are ill. And when they come to the emergency room, we give them priority. We used to do that before anyway, because if you are known in the clinic, as soon as you come in, your doctor will call you out. You don't sit. But now we even give them more priority. As soon as they get into the emergency room, we admit them straight to the ward and start treatment, because we assume that they can easily catch the COVID.
The COVID.
Yes, so we expect them to come to hospital promptly if they are not well. But for routine clinics, we want to talk to them on phone, and then we send their medications to them at home.
Okay. All right. So I'm going to be delving deeper into what sickle cell is for a lady of about 25 years old or 30 who is thinking of getting involved, with a partner, or maybe getting married to have children. What do we say about people like this? Do they have normal chance of getting pregnant? Is it a risk for them to get pregnant? What would you say?
Are you talking of somebody who has sickle cell disease?
Yes, somebody who's got sickle cell and is a woman.
Oh, okay. Now, persons with sickle cell disease or women with sickle cell disease are encouraged to register with a gynecologist very early, before the pregnancy, before she decides on her pregnancy. She needs to register with a gynecologist.
Okay.
The fact is that because they have sickle cell disease, their blood level is usually quite low.
Okay.
Yes, and they need to have constant follow-up. Now, the gynecologist will follow them up before they get, and of course, they can get pregnant, yes.
Okay.
They can have children, and they can have, usually, because of the crisis they get during pregnancies, most will not have more than 1 or 2 on their own, but not because they can't have them. But some go ahead to have even more. And the SC genotype actually go ahead to have normal kids like everyone else. But for the SS, the doctors are very careful and the monitoring is very intense. Actually, in some centers, they have specialist doctors for just sickle cell pregnant women, and they follow them up very closely, their delivery and the post-delivery, make sure they have enough blood, and it's all sort of arranged before the woman gets into labor.
Okay.
Yes, and their labor is really supervised by a whole big team, so that everything can easily be picked up very quickly.
Awesome.
Yes.
So I'm coming back to you, Victoria. Now that you have a daughter who is up to 13 years, I mean, now she knows what pain is and she knows that she's got this, situation. What is the plan for her? Medically here in Ghana, do we have psychological, assistance for them to be able to accept that, okay, this is what, I am and this is how it's going to be. I need to love myself. I need to feel accepted. I don't have to feel uncomfortable in the midst of other children. How is it for your child?
I think for my child, because she grew up fairly, okay and well, and kind of did most of the things other kids could do, but in moderation. She hasn't seen herself differently from any other child, except that she knew, you can go swimming, but you can't go swimming all day long, things like that. So for us, it's a matter of making sure that she accepts who she is, understands, her condition, and then take ownership of also, making sure that she, lessens her crisis and stays out of the hospital. And she's coming to a point where she actually gets it now. She knows that, there's certain things I can't do. She'll even tell me before I tell her, yes, I need to drink a lot of water. I need to make sure, I'm taking my medications.
Yeah.
So she knows that very well. I think in Ghana, the stigmatization issue is still very much there. And I think that's why the association is there. And that's why I decided to even get involved in the association. And, our job, our role is to make sure that we break down the stigma and, go out there and educate people. Let people see the different faces, of people with sickle cell, what that looks like, how far people can go and achieve things in life and have a normal life if they are willing, and I stress on that, willing, to follow the necessary precautions, to work with their providers, they can really live a fulfilling life. And I think for us, that's the work that we have ahead of us, is really breaking down the stigma that we have in this country.
Okay, thank you very much. We're going to be going for another quick commercial break. When we come back, we are still going to be asking the parent and the doctor much more about sickle cell. However, our phone lines are going to be on the screen, and if you've got questions around sickle cell, it will be your time to call after this short break. Do stay tuned. You're welcome back. Just before we went on the commercial break, we're having a very interesting conversation about how children react to the situation when they find out that they have the sickle cell. And it was quite good because in Victoria's case, her daughter has grown up to really understand the situation and knows how to take very good care of herself. If you are a child watching us right now and you've got sickle cell, do you know exactly what you're supposed to be doing? The doctor is going to tell you what to do, okay? But the phone lines are open right now, and we would like you to call us and ask us any question that you feel you need to know about sickle cell. So while we wait for you to call, I'm going to go back to the doctor to ask the doctor right about children again. I wanted to understand, and for our audience to understand too, what is the situation with children who probably are, get sick all the time in school? What do we do? What actually is supposed to be done around such a child? Because it's going to get the child to be bullied. Probably, people will laugh at the child.
That's true.
How do we actually treat such children?
Okay, so the first thing that we recommend is that the child should be enrolled in a sickle cell clinic,
Okay.
because then you get to meet a team and the team will take care of you. Sickle cell disease is not managed at home. It's managed in the hospital alone.
Okay.
So if your child has sickle cell disease or you suspect your child has sickle cell disease, the first thing is go to the hospital and ask to go to the sickle cell clinic. Your child will get tested and your child will start treatment. And then that's when you get the counseling.
Okay.
And we have medications that we can put the child on that can reduce the child's risk of having infections. For instance, we know that infection or bacterial infections like pneumonia can kill children with sickle cell very quickly, within hours.
Okay.
So we put all children with sickle cell right from birth. We put them on a medication that prevents them from getting pneumonias.
Okay.
You see, and if you don't attend clinic, you won't get that medication. So all children below the age of 5 with sickle cell disease are on prevention for pneumonias. Secondly, if you attend clinic, the doctors will make sure that if they think you have malaria, it is treated very quickly. If your blood level is going below a certain level, it is treated very quickly. And if you're having a lot of complications, we have medications we can put you on. And I think Vic can share her experience with that, so that your child does not fall sick often and your child can go to school like every other child.
So in other words, you're saying that if your child consistently goes to hospital to get, her routine, medicals,
Yes.
it's very likely she's going to live normally and will not be falling sick all the time.
Yes,
In
and
most
even
cases, the
if-
sick ones is because they actually are not really registered in hospital.
And even if you fall sick, the doctors know what to do because they know you and they know what to do. And then they can give you the options. We have lots of options. We can do, for instance, some children are on blood transfusions every month.
Okay.
That is an option that we give. Some children are going for bone marrow transplant. And Ridge Hospital, they have a bone marrow transplant unit. So these are things that we can talk to you about if you attend clinic. And we can give you the sequence and you can make a decision on what to do. And I think Vic can share her story of her kid and some of the decisions she had to make on the medications and stuff for her child.
So that brings me to, I read up about Novartis.
Yes.
And what is going on with Novartis. Can you tell us exactly what experience you're having with Novartis right now?
Well, so Novartis they manufacture the medication called hydroxyurea.
Okay.
And this medication has been known to be a breakthrough medication for people with sickle cell disease. It helps to lessen the crisis that children have, and to actually
that's
improve.
Wonderful.
Yes, it's actually improve their levels so that they can continue to live a meaningful life. And so Novartis they launched the hydroxyurea medication towards the end of last year, and had offered a lot of hydroxyurea medication for free to Ghanaians living with.
Thank you so much, Novartis. We really appreciate this effort of yours, trying to make it better for our children and for them to live longer and live with with less pain and less crisis. We want to say a very, very big thank you. So how did your child receive it? Did she react to it, or it just went well with her system?
Well, first you have to go through a series of testing. So the doctors did a fantastic job explaining, the benefits of Novartis. But I'm sorry, the hydroxyurea medication.
Okay.
And so you go through the series of lab testings, and then once the results come back and the child is a good candidate for the medication, the child is started on the medication, and it's tapered. So they start them on a lower dose and then gradually increase with additional testing and monitoring. And so once it's determined, the optimum level or dosage is determined for the child stays on that dosage of medication. And so you just do routine lab work once a month that goes to the doctors just to let them know that, the medication is still being well received by the child and it's doing what it needs to do. And I find personally for, my child going on this medication, it's reduce her, crisis significantly.
Okay.
Before we would go to the hospital maybe 10, 15 times a year, or sometimes more, for various crises and maybe perhaps infections. And now it's, I would say we are, less than 5 a year for,
That's
and
good news.
sometimes, even, when we show up, the doctor is surprised to see us, and they will say, "We haven't seen you in a very long time. What
Oh,
are you
and they're not
doing
going to see
here?"
you anyway.
Yes, yes, and I think it's all to the benefit of the hydroxyurea medication and how well it's doing for people living with sickle cell. And just going back to the point about the schools and children missing schools, and for my child, if they have to miss schools, a lot of the schools, as I have come to learn, are very understanding in working with parents, especially if you let them know what is going on. Some of the teachers will even package homework and classwork and send it to the child. So even when the child is in the hospital, if they want to learn, they can do that. And we've worked, very well, even from, living outside the country and coming to Ghana. We've worked very well with various teachers where they're able to give the child assignment work so that they don't miss out a lot on school or have the opportunity to make up work that they've missed from school. From being in the hospital for whatever reason. So
Fantastic.
it's,
This is really fantastic. I've gotten a question here. Somebody is asking, my husband is an SC, and he's not really interested in having sexual relations with me. We have 4 children already, and I want to have an extra one, but he's always complaining. Okay, so I think what she wants to find out is, does it affect their libido, or maybe how they perform? Do they feel some kind of pain? Probably the husband is not saying what it is, but she feels that maybe from what we are saying right now, it feels like maybe this is what this guy is going through and he's not able to let her know. Do you know of
Well,
anything
yes,
that happens to them sexually?
it's actually not a good thing to say whatever the person has to do with sickle cell disease, because we know that normal men can have loss of libido as well. So for this person, I would recommend they see a urologist as quickly as possible, because it's more likely to be growing up, men having issues growing up.
Okay.
Having said that, sickle cell can have its own issues with fertility and impotence because of they have this priapism.
Okay.
It's when they get crisis in the male organ, and that's a very painful erection that does not go away, and it's so painful they have to come to hospital for it to be relieved. And so some sickle cell persons have that often, and that can be a problem. But like I said, it's all best managed by a trained specialist who can help them sort that out. But I wouldn't want, and that's a challenge we have. Everything that happens to a person with sickle cell disease, they want to blame it on sickle cell disease, but it's
that's not the
everything.
case.
No,
you just need to verify it first
please,
before you blame sickle
so
cell.
please see a doctor and let a doctor examine your husband and see what the actual problem is.
Yes. All right. So we are getting very close to the end of the program, but I'll not want you to leave here without speaking, to our audience. So, doctor, you're going to advise our audience on what to look out for, or whatever it is you feel that we really need to know that we've missed out on. And then, Victoria, I would like you to also speak to parents who are having to battle with their children, who are suffering from sickle cell. Encourage them, and let them at least express the kind of joy and satisfaction that you are right now. We'll look forward to it. So, doctor, please, that's your camera.
So we would like to tell all parents and persons with sickle cell disease that you do not need to be alone in trying to solve your problem. If you come and register, for instance, in a clinic, we have adolescent groups with sickle cell, we have adult groups with sickle cell, we have the association, and you can meet other parents who can share their experiences with you, and so that you can learn. And then you would know that you are not alone, and you don't need to go through all this alone. And then for parents who are so scared of any new medicine that comes because they've heard that then it can affect my child, it can affect my child when he's grown, we know that sickle cell disease on its own does not allow people to grow so much. But if you can have a medicine that can let you grow to an age where if we have another treatment, you can continue to grow, we think you should take advantage of it. Because it's really sad to hear of persons with sickle cell dying at a young age because the parents refused all medications. If you have a child with sickle cell, we don't think you should continue blaming yourself. Bring your child and let's work together so that you'll be happy and your child will be happy. Don't let your child suffer unnecessarily. Please bring your child to
clinic.
Thank
you very much. So you can also talk to the parents quickly.
Well, hi, parents. I think for me, the only thing I would say is that, you know, children are a gift from God. And if
Definitely.
you're blessed to have a child, and you love that child and you realize that the child has a condition, which is sickle cell disease, I urge you to try and, like Dr. Bruce said, visit the hospital, make sure that you register your child for the sickle cell clinic, and work closely with the doctors. And you'll be amazed at how easy managing the condition will be and how well your child will live to have a meaningful life. And you know how relieved you will be once you are able to learn about it, manage it, and then help your child live a much more meaningful life. So I would say, if you love your child, just make sure that you get them connected to the sickle cell clinic and work with the doctors. It really, all the medications, the protocols, the treatments, they work. So just make sure that you seek the help that your child needs.
Wow, thank you so much. So as we wrap up, I'd like to let you know that Father's Day is a great opportunity to appreciate the love and efforts our fathers give to us. ETV Ghana is giving you an opportunity to send a short message on what I love about my dad. The winner stands the chance of winning a fantastic gift for their dad. And the winner will be announced on Men's Lounge on Thursday, 18th June 2020. So send your messages via our social media handles at ETVGH. That's the information we've got for you. So do not miss out on Father's Day that is coming up. Some people were wishing happy Father's Day last Sunday. Father's Day is actually this coming Sunday. So make use of this opportunity that ETV is presenting to you to be able to get your father something really wonderful. Thank you very much for watching. The repeat broadcast comes on Saturday at 12 noon. So see you next week. Bye-bye.